How do doctors actually fix a broken jaw? Is it just wiring the mouth or something more advanced? Let me explain exactly how we treat it today. Hello, I'm Dr. Vikram Singh, oral and maxillofacial surgeon, and in this video, I'll walk you through how I diagnose and treat a broken jaw step by step. A broken jaw or a mandibular fracture means there's a crack or break in the lower jaw bone, usually caused by road accidents, falls, or sports injuries. When a patient comes in, I first check for pain, swelling, and changes in the bite. Then we confirm the fracture using imaging like CT scan or X-ray, which helps us understand the exact location and severity. Not all fractures need a surgery. If the fracture is simple and stable, it can be treated using wires or elastics to keep the jaw in position while the bone heals naturally. But if the fracture is displaced or the bite is affected, then surgery becomes necessary. During surgery, the broken bone segments are carefully repositioned and fixed using titanium plates and screws. These hold the bone firmly in the place and allow proper healing. The best part is that these plates are usually left inside the body and do not need any removal in future. After proper treatment, patients can gradually return to normal eating and speaking. And with modern techniques, results are very predictable and stable. If you ever suspect a jaw injury, do not ignore it. Early treatment prevents long-term complications. If you found this helpful, share it with someone who might need it, and subscribe to the channel for more reliable medical information.
Subscribe for more content.